I'm Dr. Manisha. I'm working as a medical lead in Medical Affairs Division of Specialty Care of Lupin Limited. I extend a warm welcome to all of you in this brief discussion on patient awareness program for patients of PCOD and mental health diseases. Here joining with me today is Dr. Day, who is very well-known psychiatrist, and she will be taking us through important aspects related to mental health disorders in patients with gynecological disorders, especially PCOD. Welcome, ma'am.
Uh, Hello, everyone. So I am Dr. Shatavisa. I am a consultant neuropsychiatrist from Kolkata. I first of all want to extend my thanks to the organizers for arranging such a beautiful program. Polycystic ovarian syndrome or PCOS is a matter of increasing concern nowadays, especially in women having sedentary lifestyle. And about 13% of the women they are seeking treatment for their PCOS, but there are 70% of the women who are still undiagnosed, and this occurs due to lack of awareness. So this type of awareness programs are really important, and I want to thank the organizers for arranging such a program and making me a part of it.
Yes, very nicely said, ma'am. So, taking the cue from what you have just said, very important aspect you have highlighted here. So, is it true that PCOD affects the mental health in women? And if yes, how does this condition affect her mental health? Can you more give the elaboration on this?
Look, I must say what PCOS is. Polycystic ovarian syndrome is an endocrine disorder. To simplify, it is a hormonal disorder where some kind of hormonal imbalance is there. And one of such hormonal imbalance is an hyperandrogenic condition. That is, the level of male hormones is much higher than normal in women having PCOS. In normally where the testosterone level is should be much lower than 21.8 millimole per liter, here the level is much higher. And because of it, there are some symptoms like there are hirsutism, increased body hair growth, male pattern baldness or androgenic alopecia. Also, there is insulin resistance, which can cause obesity. These women having PCOS, they are much obese. There can be acne. So these are the cosmetic deformities the women have. Also, there are menstrual irregularities. These menstrual irregularities are in the form of oligomenorrhea or amenorrhea. That is, normally the menstrual cycles, it occurs once in 28 days. But in this women having PCOS, the menstrual cycles are wide apart. That is, it occurs at an interval of more than 45 days. Sometimes there is a cessation of menstruation for a longer period of time, or complete cessation of menstruation causing amenorrhea. So these are the problems, menstrual irregularities the women have, which also causes difficulty in fertilization. And also there are, if we do an ultrasonography examination, it is seen that there is polycystic appearance, that is multiple cystic follicles are there at the outer edge of ovary, which is decreasing the functional reserve of ovary, which is important for fertilization. So, for this reason, there is subfertility or even infertility. So, these are the symptoms the women of polycystic ovarian syndrome have, and these symptoms have a keen relation with mental health. These some mental health symptoms are there in polycystic ovarian syndrome, and it can be explained in two aspects. Like one is the neurobiological aspect, and another is the social aspect. The neurobiological aspect is where the symptoms are occurring due to the disease itself. We all know that polycystic ovarian syndrome, as I have said, it is an hormonal disorder. So there is an hormonal imbalance due to which the mental health symptoms like depression or anxiety can occur. Also, there is a condition called as insulin resistance, and insulin is important for our fat and carbohydrate metabolism in our body. So, this insulin resistance can cause obesity, which is another cause of depression, which is adding to the depression. Also, there is imbalance of HPA axis, that is we call as hypothalamic pituitary adrenal axis. And due to this imbalance in this axis, there can be depression. So the symptoms of depression and anxiety can be explained neurobiologically. That is due to this hormonal imbalance, due to this hormonal disorder itself, the patient is having some kind of mental health symptoms like depression or anxiety. And another is the social aspect. That is the women here in their adolescence or in their reproductive period, they are having obesity, they are having menstrual irregularities, and they are having some fertility or infertility. These are the reasons for which they have to face some social problems. Like in the school, in the adolescence, the girls they are bullied in their school because of their obesity or because of their acne or because of their cosmetic defects. And also in reproductive age, if they are not able to conceive in our society, Indian society, where women are considered as childbearing machines. So if a woman is getting it difficult to get conceived, so there is a mental pressure on her. So there are these social problems there, because of which women are more prone to have depression or anxiety. And it has been seen that this depression and anxiety, it is three times more likely in women who are having PCOS. And also there are other problems, like there is some sexual dissatisfaction in women having PCOS, which can give rise to some marital discord or some domestic problems. Also, there can be some sleep problems or eating problems like bulimia nervosa or binge eating disorder. And it has also been seen that our severe mental disorders like schizophrenia, bipolar spectrum disorder, these are also more common in women having PCOS. There are some literature, some studies which are stating that this schizophrenia and bipolar spectrum disorder, these are also more common in women having PCOS. And also,
Yes,
if these women they get pregnant, it has been seen that their child, they are more likely to have some kind of mental illnesses like ADHD and autism spectrum disorder. So there are a
right.
variety of mental health symptoms
Yes,
with PCOS.
yeah. So, you have actually very nicely presented and explained how these are closely associated. But the problem starts when patients, as well as even physicians, treating physicians, try to identify the signs and symptoms. But generally, these mental health related signs and symptoms are hidden and remain untreated for a long duration. So, is there any kind of warning signs and symptoms are generally presented in such kind of patients? You would like to give the advice to others that these are actually warning signs and you need to pay attention to that. So, can you elaborate more that signs and symptoms part?
See, the primary point of contact with the patients is always on the part of the gynecologist, because a woman having PCOS, she will always come to a gynecologist for her symptoms. So it is the duty of the gynecologist, or it is the chance for the gynecologist to screen some symptoms, some mental health symptoms in her patient, and refer that patient to psychiatrist. But it is practically not possible to refer almost every patient to the psychiatrist, and it is also adding to the social stigma, because in our Indian society it has been thought that some problem on part of my mental health, that is I am having some abnormality, so I am being referred to the psychiatrist. So
Yes,
it can add to the stigma. So I can
yes,
say that there are some symptoms which can be screened in the patients. Like the gynecologist can ask the patients, how are your mood nowadays, or how are you feeling nowadays, or are you feeling low for the last few days? Or he or she can ask that, how are your marital life going? Are there some problems in your marital life, or everything is okay? So these are some points, these are some simple questions that can be asked to the patients, and here the patients can break loose. because if
Yes.
they are feeling low and if they are being asked that are you feeling low, they can give some additional history to the doctor, or if they can if they cry, it also proves that they are having some mental health concerns. Also, the patients,
Yes.
they can have some sleep problems or even some anxiety symptoms like excessive worries or excessive like mental tension they are having, or some kind of physical symptoms like excessive sweating or tremulousness or palpitations like that. And these symptoms can also be asked on the part of the gynecologist.
Yes, yes, correctly said, ma'am. Thank you for this information. Very valuable, important points. Actually, that makes the difference in patients as well as their caregivers' life. So it is very important to ask about the emotional well-being of the patients when they come for the other gynecological condition. And acceptance has been a major challenge for them also to
Mm.
consider it as they are having some mental health. So it is generally stigmatized, as you rightly said. So definitely, but does it is so difficult to manage? So I would like to request you about give some information about the management part. How generally these patients are managed and how it is easily can be detected and managed easily if it is early diagnosed.
Look, the main concern is to pick up the earliest signs and symptoms. As I have said, that the earliest signs and symptoms is mostly missed. And when the patients come to the psychiatrist, they are already having some severe kind of symptoms, or it is beyond control, or it is difficult to control. But if the earliest signs and symptoms can be picked up, it is very easily it can be managed. And we first, with the psychiatrists, first screen the symptoms and grade the symptoms, how severe they are. And if the patients can be managed by non-pharmacological techniques like counseling and other form of psychotherapy, we can refer the patients, or we can do ourselves psychotherapy on the patients. And if the patient needs medicine, we will give them medicines like our antidepressants or anti-anxiety drugs. But some kinds of drugs we generally avoid, like sodium valproate, which can worsen this PCOS-like symptoms. So we will give them that drugs which will not interact with the drugs she is having for her hormonal problem. And in the form of drugs, these symptoms can be easily managed. It is not difficult to manage the symptoms.
Yes, yes. So at the end of the session, what advice you would like to provide to our viewers on importance of regular mental health checkup and its early detection in patients who are having some chronic conditions?
Look, I can say that mental illnesses are always the tip of iceberg. The patients we treat with medicines or counseling are much less than the patients who are actually having mental health problems and still are undiagnosed. It is due to lack of awareness in the society, in the patients. They always, most of the cases, they fail to pick up the earliest signs and symptoms of mental health concerns. And because of reason, they are not coming to the psychiatrist, and even they have the mental health symptoms, they fear to come to the psychiatrist because of the social stigma, because of the stigmatization that I have said earlier. So I will say that if you are having some mental health problems, not only in the case of PCOS, but also in lots and lots of other physical health problems, which can also give signs and symptoms of psychological or mental health, you can always come to the psychiatrist or other mental health experts for your treatment. And there are some false notions that if I am having mental health disorder, so it proves that I am abnormal. Or if I have to take the medicines, the psychotropics, it proves that I have to take it lifelong, or there are lots and lots of side effects of these psychotropics. All of these are very false notions. And I would say that if you are having mental health concerns, uh, pick up the earliest symptoms, be aware, and come to mental health experts for your treatment.
Yes. Thank you, ma'am. So before going ahead, as we have come to end of the scientific session, I would like to take a moment to express my heartfelt gratitude to you for being here and sharing the information. And it is your busy practice, I understand, and still you have come here for the patients for their better outcomes. So I am really very thankful, and your thoughtful and insightful comments and this discussion has truly enriched our experience, and definitely it is going to help our viewers also for deciding what is the importance of mental health diseases in such chronic conditions. So I am very thankful to you, ma'am. Here we'll end the session. Thank you, ma'am.
Thank you.